Hello, welcome to the second episode of FIP CPD Bites in the series titled Let's Talk About Vaccines. The three-part series serves as an educational tool for pharmacists and pharmacy teams on the benefits of vaccinations and specific vaccines in special populations. In this episode, I will be leading you through our second video discussing the importance of the influenza vaccine, especially in high-risk groups. Understanding influenza. Influenza is highly contagious and presents a significant global challenge, leading to substantial mortality and morbidity. There are around 1 billion cases of seasonal influenza annually, including 3 to 5 million cases of severe illness. It causes 290,000 to 650,000 respiratory deaths annually. Certain populations are at greater risk of severe disease, such as pregnant individuals, children under 5 years of age, older adults, individuals with chronic medical conditions such as cardiac, pulmonary, renal, or metabolic disease, and individuals with immunodeficiency disorders or on immunosuppressants. The presentation of the influenza virus can vary acutely and chronically. In the acute presentation, individuals may experience a sudden onset of fever, cough, headache, muscle and joint pain, severe malaise, sore throat, or runny or stuffy nose. In the chronic setting, individuals with diabetes may experience stress-induced hyperglycemia. Individuals with cardiovascular disease may experience increased risk of myocardial infarction or stroke, and in individuals with chronic respiratory disease, individuals may experience lung inflammation, COPD, and asthma exacerbations. Every year, the World Health Organization utilizes a surveillance system to collect data on the annual circulating strains to formulate the year's influenza vaccine for each hemisphere. There are trivalent and quadrivalent vaccines. Trivalent vaccines have type A H1N1, type A H3N2, and one type B antigen. Quadrivalent vaccines include type A H1N1, type A H3N2, and two type B antigens. Included in this group of vaccines is the high-dose quadrivalent vaccine, which is preferentially recommended for people 65 years and older. There are several different types of influenza vaccine. The first is inactivated influenza vaccine. This is administered by intramuscular injection, which is available in multiple presentations, including manufacturer-filled syringes, single-dose vials, and multi-dose vials. It is also available in preservative-free formulations, and some products contain residual egg protein. The second type is the live attenuated influenza vaccine. This vaccine is provided in a manufacturer-filled single-use intranasal spray. Half of the dose is sprayed into each nostril. This contains residual egg protein as well. The last is the recombinant influenza vaccine. This is administered by intramuscular injection and does not contain egg protein. Influenza vaccination in adults. Annual influenza vaccination has shown remarkable benefits for older adults and individuals with cardiovascular disease, diabetes, and chronic respiratory conditions. One of the most common complications is post-influenza pneumonia, which is also the leading cause of mortality in influenza. Among individuals with diabetes, some risks include that these individuals are more susceptible to certain infections and might experience increased severity or more complications. Diabetes is considered a risk factor for severe presentation of an influenza infection. In terms of protection, the influenza vaccine aids in reducing flu-associated hospitalizations among diabetic patients. Furthermore, evidence indicates fewer hospital admissions for CV events in this group. Ultimately, in patients with diabetes, getting vaccinated can reduce the severity and burden of influenza. In terms of individuals with cardiovascular disease, some risks are also present. Influenza leads to a systemic inflammatory response and a risk of dislodging atherosclerotic plaques. Infection is correlated with an increased risk of cardiovascular events in patients with existing CVD. In terms of benefits, vaccination can increase cardiovascular protection by modifying atherogenesis. The benefits are particularly pronounced for individuals with active coronary diseases. Last, we have individuals with chronic respiratory conditions. Some risks include that patients with concurrent respiratory diseases are at risk of exacerbation of symptoms, hospitalizations, and lower respiratory tract infections. Some benefits of vaccination are that vaccination has been associated with reduced exacerbations and influenza related complications, reducing hospitalizations and death. According to the World Health Organization, annual influenza vaccination is recommended for people over age 65. Because the human immune system becomes weaker with age, also known as immunosenescence, older adults are at higher risk of developing serious complications from flu compared with young, healthy adults. Up to 70% of influenza related hospitalizations and up to 85% of influenza related deaths concern adults aged 65 years and over. In older adults, influenza can also trigger a progressive loss of autonomy, leading to increased healthcare resources and the need for home care and long term social care. Diabetes, asthma, and chronic cardiovascular disease, even if well managed, are among the most common comorbidities that place people at higher risk of developing serious flu complications. An annual flu vaccine is the best way to reduce the risk of flu and its potentially serious consequences in older adults. There are three preferred formulations of the flu vaccine in older adults: high-dose quadrivalent inactivated flu vaccine, quadrivalent recombinant flu vaccine, and quadrivalent adjuvanted inactivated flu vaccine. The influenza vaccine during pregnancy can protect the pregnant individual from flu and potentially serious complications. Since the vaccine is not effective in infants younger than 6 months, passive immunization of fetuses through transplacentally transmitted antibodies is currently the best prevention strategy for newborns. Thus, maternal influenza immunization is an essential component of prenatal care for pregnant individuals and their newborns. Generally, no vaccine is preferred over another unless there are specific contraindications, such as a history of Guillain-Barré syndrome within 6 weeks post-influenza vaccination, previous anaphylactic reaction to an influenza vaccine, and live attenuated vaccines in pregnant individuals. Of note, live vaccines are not recommended for those with compromised immune systems. Live vaccines are also not recommended for patients with comorbidities such as cardiovascular disease, diabetes, and chronic respiratory conditions. Some considerations for individuals with egg allergies are that they can generally receive the flu vaccine without any special precautions. Current research suggests the likelihood of allergic reactions in this group is minimal. Age recommendations for vaccinations of older adults may vary per country. Check your local and national guidelines. Some common side effects of the influenza vaccine include local injection site reactions, such as soreness, redness, or swelling, or systemic reactions such as fever, muscle aches, and headaches. Pharmacists can play an important role in vaccination. Pharmacists should stand ready to provide advice and address any questions regarding the influenza vaccine. Pharmacists also play a pivotal role in promoting vaccination awareness and uptake and advocating for vaccination. Here is a list of useful resources and a QR code to the FIP microsite on vaccination.